Thank you for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We are in the midst of the COVID-19 pandemic, and we continue to have our conversations in the hope that the more we know, the better we are equipped to fight this pandemic off. As usual today and every day, I start off by wearing my mask correctly to cover both my nose and my mouth. And I want you to see that this is important, not just to wear it to cover the mouth or the nose. It is not useful at all to wear the mask covering the chin or on top of your head. But for the rest of this conversation, I will take it off because I am not close to anyone, definitely not within 6 feet of anyone else as we're recording this program. So we're talking about COVID-19, the way it's affecting us in Guyana, the way it's affecting us around the world. And I would be very happy if you can send us your questions or comments to a WhatsApp 620-6275 or send an email to docandcovid@gmail.com. The big thing that people have been worried about recently as it relates to vaccines is the association with vaccines and blood clots. It's a very important thing to consider, but I wanted to put this in perspective and to demonstrate that while we may recognize that there is a risk, we need to understand how small or how large this risk is and make an informed decision about whether or not to take the vaccine. Me personally, when considering all of the pros and the cons, all of the risks versus the benefits, I am still of the firm belief and opinion that the benefits far outweigh the risks. Far outweigh the risks. So let us look at the risk of blood clots with various known factors that can cause blood clots. With the AstraZeneca vaccine, blood clots have been seen in 4 cases for every million vaccine given. That's 4 in a million, or 0.0004%. Remember that. That's less than 0.001%. Common thing that we do can also cause us to be at risk for blood clots. The use of birth control pills, for example, in women, has a risk of 500 to 1,200 persons or women developing clots for every million user. And that's a 0.05 to 0.12%, several times greater than the risk for blood clots in vaccinated people. In those who are smoking, the risk for blood clots is 1,763 persons for every million smoker. That's a 0.18%. And just by having COVID, before any vaccine or before taking any vaccine, the risk of developing blood clots just from having COVID is 165,000 people per million cases of COVID. That's 16.5% risk of developing blood clots just by having COVID alone. That's before getting any vaccine. So it just does not add up when you compare the risk for getting blood clots from taking any of the vaccines. If that risk is really so, then it's 0.0004 versus 16%, 16.5% to be exact, of getting blood clots just by getting COVID. So it doesn't really follow that one should be that much more concerned about blood clots after taking the vaccine than actually getting blood clots from getting the infection. If you look at blood clots versus COVID itself, some of the symptoms that you can see in blood clots versus symptoms that you can see in COVID. In blood clots, persons can complain of sharp chest pain, they can have discoloration to their skin. Sometimes, especially if the clots move and go to the lungs, they can have unexplained cough, and sometimes the cough can have some streaks of blood that is mixed in the whatever you bring up, that we call the sputum. Sometimes, again, if the clot moves and goes to the lungs, it can cause sudden shortness of breath. It can cause a rapid heart rate. And if the clot is located in the arm or the leg, people can have swelling in those areas, as well as an increase in temperature in that localized area, or what we call warmth. And sometimes it can also cause pain at the site where the clot is, or just below or distal to where the clot is. In COVID, the symptoms that are more common with COVID include things like delirium or confusion, fatigue. The most common thing that people develop is fever. Then they can have loss of smell or taste. They may also have persistent cough, hoarseness in the voice. Sometimes they'll get shortness of breath, especially when the lungs become more involved. And that is when we check your oxygen saturation, and if it is low, we become much more concerned and people are referred to hospital for hospital level care. Chest pain is also a feature of COVID-19 infection, and sometimes people don't feel like eating, they will skip their meals, and sometimes they can also have abdominal pains. So these are all features of COVID infection versus when you get blood clots. And it's important to differentiate, and although there are some overlapping features, it is important to differentiate one from the other. In particular, the sudden nature of shortness of breath, coughing, and chest pain is more consistent with blood clots, especially if the coughing is associated with bringing up stuff that has streaks of blood or flecks of blood in it. So it's important to know those things. There are also known lingering or long-term effects of having COVID-19. Some of these are unusual and some are more usual. Well, a lot of patients have now, in Guyana at least, and around the world, have reached that stage where they would have recovered a long time ago from COVID, and now they're developing or experiencing and recognizing some lingering symptoms. These things include fatigue, headaches, mood swings, sometimes chest pain itself, difficulty breathing. Some of these patients may also have palpitations. Palpitations is when you feel your heart fluttering, it's beating too fast, or it's thumping in the chest. These are all things that people can experience on a long-term basis. Quite a few patients are also complaining of things like confusion, dizziness, a numbness in their limbs or in their head itself. And some persons, unfortunately, can develop blood clots that can be either in the legs, or they can move off, or they can cause stroke when blood clots develop in the brain. Other things that occur in patients on a more lingering basis are things like loss of taste and smell, or ringing in the ears. Some people may have pins and needles in their fingers and toes or arms and legs. They may also experience things like loss of appetite and weight loss as well. And occasionally, people may also have skin rashes and these things can be discolorations, and sometimes they can cause people to be concerned about all kinds of blood problems and blood disorders, and they tend to seek medical attention for those. Blood clots, however, are a specific concern of the COVID-19 vaccine. And even though it is very rare, what is rare about it even more so is the location, because it occurs in unusual places when it does occur. And remember, it's 4 in a million. So if we assume that Guyana has 1 million people, and if we were able to vaccinate every person, we expect that based on this statistic, there will be 4 persons who develop these types of blood clots. The rarest of the lot are in somewhere in the brain, and then there's another set that occurs in the abdomen near the liver. 4 out of a million, and then 10% of those persons, unfortunately, may die from these blood clots. So that is less than, 1 person, for example, in a population like us. So we're very lucky, we're very fortunate that we have not yet seen, and we hope we never see these types of complications in our patients. Why are blood clots important? It is important because of the effect that it can have on people. It can, depending on where it is formed or where it's located, it can cause problems downstream. For example, it can block up blood flow in the arms and the fingers and the feet. And when that happens, the areas that are beyond the blockage can become discolored, they can die off, and people can also have to get amputations, or surgeons may want to cut off that piece of the finger, the limbs, the toes, etc. Because otherwise, if it dies on you, it can actually poison the body by the toxins that are released. The reason for clots occurring in the COVID-19 patient is not fully clear, but it's possible because these persons may also have underlying problems related to clot. Some of them, especially who are in hospital, they may be immobilized for a prolonged period, especially if they're in an ICU setting and they're on a ventilator. And sometimes another possible reason for clots being formed by having the COVID-19 infection alone is because the infection can cause the inner lining of the blood vessel to become inflamed, and thereby attracting these clotting factors and platelets, etc., to go there and actually form clots. So the clots basically have 3 main things in the blood. The blood is, a collection of several active things that are circulating with every beat of the heart. But to form clots, there are 3 main things that are at play here. One is the platelets. These are the sticky parts of the blood responsible for stopping bleeding. Then there are fibrin particles, and of course the red blood cells, which all come together to form clots. And when clots are formed, depending on where they're formed, they can reduce blood flow or totally stop blood flow. When this happens in the heart, for example, it can cause a heart attack. When it happens in the brain, it can cause a stroke. And it can occur actually at many places. So blood clots can cause strokes. It can cause restricted blood flow in the lungs, and it can cause impaired oxygen exchange in the lungs. And these are all things that lead to shortness of breath and sometimes chest pain, etc. So I wanted to spend this time to talk to you about the potential side effect of blood clots that have been linked to vaccines, and I want to specifically let you know of how small the risks are It's less than 4 in 1 million vaccinated people, and the risk of getting blood clots just from COVID alone without vaccine is more than 165,000 people per million by itself. So I want to make sure that we understand the risks and the benefits as we make our choices about vaccination. Thank you once again for joining me, and remember, if you have the opportunity to get your vaccine, I strongly recommend that you do. If you have a question or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thanks again.